I want to talk about PRP, which stands for Platelet Rich Plasmapheresis. Platelet Rich Plasmapheresis is one of my favorite rejuvenation techniques. It's been around for years. Athletes are busy injecting it into their joints to repair, restore, and we are now in a significant way injecting it into faces, under eyes, eyelids, into hands. I find that as far as what works as rejuvenating, beside the things you always hear me talk about, which is your supplementation, your food, your exercise, and then skin products that work, peels, certain lasers, platelet-rich plasmapheresis does something that nothing else does as well. So what is platelet-rich plasmapheresis? Well, what you do is you come in and we draw some blood out of your arm into these very special vials. These vials basically bind the blood at the bottom, and it just leaves the serum. And the serum is the clear part, and it's got platelets in parts of that serum. The platelets contain the growth factors. You see in skin products, everybody's got peptides and growth factors, whatever. Those growth factors are very sensitive. It's hard to keep them alive outside the body. That's a whole other subject. But the growth factors are contained in the platelets. So if you have surgery, if you skin your knee, if you break a bone, if you hurt yourself in any way, and a blood vessel is fractured, the blood vessel releases calcium, and the calcium basically takes the platelets that are in the blood and makes them release the growth factors, and then a whole cascade of reaction occurs, and that's what makes the body repair itself, because what those growth factors do is stimulate the stem cells that are everywhere. They make the stem cells start making the bone, the skin, the dermis, the epidermis, whatever organ, whatever piece of tissue in the body start to repair itself. So what we do is we put the platelet-rich plasmapheresis in the special vials. It's been centrifuged. Blood is at the bottom. Serum's at the top. We inject a little calcium into the vials, which activates the platelets, makes them release the growth factors. We draw it up in a syringe, and we inject it wherever we want to rejuvenate. So what do you see that it does that nothing else does? Now, I use it a lot around the eyes. I find nothing gives me better results than putting it in hands for rejuvenation, because it rejuvenates the whole skin. It basically makes the epidermis, the dermis, it makes the stem cells, which are all in the dermis, particularly in the fat, a lot in the fat, but they're everywhere. We don't know exactly where they are placed. They're everywhere. So you're injecting it everywhere. You're bathing the whole area in platelet-rich plasmapheresis. And when you put platelet-rich plasmapheresis into the skin, it just diffuses everywhere. It's very pro-immune system. It makes all the cells go back to making collagen, all the skin components. It plumps up this lipid, this fat, this subcutaneous fat layer like something I've never seen. And as we age, as we go down the path of life, as I like to say, what happens is everything thins. And so when we thin, we begin to look more like skeletons. Our muscles are thinning, our bones are thinning, our teeth are thinning, the skin is thinning, our hair is thinning, everything's thinning. And so with platelet-rich plasmapheresis, when you put it in the skin, it plumps it up. You get the younger look, because not only is it thickening the epidermis and the dermis, but also that subcutaneous fat layer, so you stop looking so much like a skeleton, basically. You stop looking so gaunt. As I say, you see the girl or the boy again. And so what it then does, the platelet-rich plasmapheresis, it just goes in, it's making everything go back to work. The body's absorbing it, it's using those growth factors. The growth factors just flip the switch and turn everything on. So it's making everything, it makes new blood supply. So underneath the eyes, instead of filler, I use platelet-rich plasmapheresis. It looks much more natural. My patients And I believe in making people look younger, but not like you've had something done. In your lips, fabulous. In your skin, in your hands, thickening the skin. It helps the tissue fill in. In your vagina with O shots. Now, you've probably read in the press about vampire facelift. With vampire facelift, they do PRP, platelet-rich plasmapheresis, and they put some filler in as well, because platelet-rich plasmapheresis will do so much. And yes, a lot of times the filler gives you the immediate results, because with platelet-rich plasmapheresis, it really takes a good 3 weeks to a month to start seeing the result. And then how long does it last? Well, the Europeans believe that it takes a year plus to get the full effect. Some people say 6 months. Number one, it depends on how healthy are you internally, because if I'm making a construction site, and this is why I care about supplementation and remedies that get rid of the toxicity and all the burdens that your body's having so that it can work more youthfully, is because the healthier this is, the more youthfully everything can respond to anything that I do to anybody. So it's going to take it a good month to really start seeing the result. At 6 months, 3 months, 4 months, you've got a great result. 4 months, people say, how long does it last? Whenever you do something to somebody, you are turning back the clock. You are resetting. We can't freeze you. We can't suspend you in animation so you continue to age. You age more quickly as you go down the path of life. But I'm turning back the clock. So it works forever, basically, because I've reset the clock. Now, it matters that you're doing everything internally, because, again, if I'm making a construction site, I've got to have the construction materials on site. Otherwise, you're not going to get as good a result. But platelet-rich plasmapheresis, no matter where you put it in the body, significantly, you see the rejuvenation. Is it a miracle? There is no miracle. Nobody has a magic wand, but it's a very important piece of the puzzle that works like nothing else seems to work. And for the hands, when you use platelet-rich plasmapheresis instead of filler, in my experience, in my opinion, gives much better results that look much more like you haven't been done.